Hi, this is Kirsten Hanahan from the University of Iowa Healthcare. Did you know that 24% of adults and 63% of children are afraid of needles? Our research team developed the Distraction in Action tool, an app for parents and healthcare staff to help children cope with needle stick procedures. Our program of research really started with a clinical problem. About 20 years ago, one of our nurses came out of a treatment room, grabbed one of our nurse scientists and said, "We've got to do something to help these kids with procedural pain." From that point, our research team's vision became to help those healthcare professionals, parents, and children by providing them with research-based tools to help reduce the distress experienced by children during painful procedures. In one of our first studies, we looked at a variety of cognitive behavioral interventions for procedural pain, things like distraction, imagery, hypnosis, medical play, and modeling. And what we found was that distraction was highly effective and caught on very quickly with the staff and with parents. So well, in fact, that our control group became contaminated in that it worked so well that the staff wanted to start using it with everyone. This led us to conduct a series of studies on distraction. In our first NIH grant with over 500 parents and children, we identified factors that impact a child's response to painful procedures and demonstrated that most parents can be trained to provide distraction and that quality distraction decreases behavioral distress for most children. We found that parents typically want to help their young child during medical procedures, and many can be trained to be the distraction coach for their child. However, about 15% of children do not respond to the distraction efforts of their parents and displayed high levels of distressed behavior. These children need professionals to provide interventions. In our NIH continuation grant, we showed that we could use data from our first study to predict a child's risk for distress and then match them to parent or professional distraction coaches. An additional 500 plus parents and children were enrolled to refine and validate the predictive models. A key finding from our research is that distraction training increases the quality of distraction provided, and that higher quality distraction is more effective in decreasing child distress. For example, child life specialists have extensive experience and training and therefore consistently provide high quality distraction and are better at minimizing child distress. If we provide parents and other healthcare providers with some basic training, we found we could increase the quality of their distraction and probability of minimizing child distress. Clinicians and most parents can be trained to provide effective distraction, but research-based and innovative interventions are needed to achieve improvement. From the predictive models of child distress developed and validated using data mining from our multi-site studies of over 1,000 parents and children, the Distraction in Action tool, or DAT, was developed and tested for feasibility and usability in clinical practice. And here's how it worked. It's a web-based app, which means it can be accessed anywhere where you have internet access on a personal device such as a smartphone or a tablet. And the parent and child go in and answer 24 questions. Then a training video shows parents how to be their child's distraction coach during the procedure. So let's watch our video.
When your child needs a medical procedure, like having blood taken or a catheter placed, one of the best things you can do to help is to have your child focus on something fun instead of the procedure. Studies show that most children who are distracted from medical procedures are less upset and report less pain. This short video will show you how to be a distraction coach for your child. It's important to plan ahead. Select some toys, books, or apps on a phone or tablet that you think will hold your child's attention. If you don't have things from home, ask the staff to find distraction items that are right for your child. Talk with the staff about your role as a distraction coach. The professionals in the room should position you right next to your child, and they should be quiet while you do your distraction coaching. During the procedure, try to get your child really involved in the distraction. Your job is to pay attention to your child. Stay focused on engaging your child in distraction. See how these nurses bring the father's attention back to being a distraction coach? Some kids really want to watch what's going on. If your child is like that, allow quick peeks and then draw attention back to the distraction. If watching upsets your child, it might help to use a book or pillow to block the view. If you lose your child's attention, work to get it back. You may feel the urge to tell the child that everything is okay. Instead, tell your child exactly what to do. Watch how these parents help to refocus. Some children are more easily distracted by a healthcare professional, like a child life specialist or a nurse. If you don't feel comfortable being the distraction coach for your child, ask for professional help before the procedure begins. You can still be helpful by encouraging your child to pay attention to the distraction coach or holding the child in your lap during the procedure. Don't forget to praise your child for trying to hold still and focus on a distraction item. It's hard for kids to be still and calm during procedures, and it's okay to cry, but your example will help things go as smoothly as possible. Please ask your nurse or other healthcare provider for more information if you would like to be the distraction coach for your child. Working together, we can help procedures go smoothly and be less stressful for you and your child.
After the video, the DAT uses predictive analytical models developed from our research to generate a distress estimate, the child's risk for distress. The parent and healthcare staff can use the distress estimate to decide what resources are needed to help the child during the procedure, such as who will provide the distraction. Then, tailored instructions are generated based on the answers to the parent and child questions. For example, if the child states that they prefer to watch or look, instructions are different than if they state that they want to look away. Next, links to books and games are provided based on the child's age and interest. So this will be a quick demonstration of the DAT app. First, you'll see a sign-on screen, and then the parent questions, then the child questions, the video, individualized written instructions, and then suggested apps for distraction. So you can see that we have recently updated our video, but just to demonstrate kind of how it works. So the DAT, our web-based app, and other resources for distraction are now available on the University of Iowa Stead Family Children's Hospital website. And we have worked with our marketing and media team to disseminate the DAT. One of the ways that we evaluate our dissemination implementation is by capturing reach. And in the first year since we posted this website, we have had over 1,000 unique page views. We have also had 17,000 Facebook posts, and more than 2,000 people have tweeted about DAT. Our reach is mostly with local visitors, but also extends nationally and internationally to at least 12 countries. And we have also been published in professional and lay media. So we continue to work with our parents and clinicians to disseminate and implement DAT. We're very interested in how you might implement DAT in your setting, and hope that you will get on our website and check it out, try it out in your own clinical setting, and report back to us what you're doing. We're currently including it in our clinic letters, so parents get the information prior to a clinic appointment so that they can watch the video and create a distraction plan prior to their child's clinic visit. We're also including it in our clinical education for staff and have plans to put it on our OneView integrated patient technology system. We are also making plans for future dissemination and implementation research. So I thank you for listening today. I would also like to gratefully acknowledge the work of our research team, including my co-investigators, Anne-Marie McCarthy and Charmaine Kleiber, as well as some of our funding sources, which include the University of Iowa Hospitals and Clinics, the University of Iowa College of Nursing, the National Institute of Nursing Research. The Mayday Fund has provided us with funding for our videos. We've had funding from our Institute for Clinical and Translation Science, ICTS group, for development of the app. We have done a crowdfunding effort, raised over $10,000 from our crowd, so appreciate them for supporting this work, and encourage you to contact us if you have questions or are interested in using that in your setting. And have provided you with some references to our research work as well as other research on distraction. Thank you again for listening.